Welcome to my podcast. Today I'm going to talk about another important case I just read and I thought to share with you for our knowledge and to be aware of such conditions. So basically, after you introduce yourself and double check the patient name, date of birth, a young lady, or could be even a teenage who will present to you with some discoloration that they panic from, whether in their axilla, in the inguinal area, or could be in the palm or the sole. Or generally speaking, they're gonna say like, I'm having stains in my clothing and it's bothering me and it's ruining my clothes and just make me embarrassed. So I just want to get to the top and to the bottom of the issue and find out what might be the issue. So in that condition, you need to think about some differential quickly. And you need to ask the patient if they have any thought, might be the reason, if there's anything new they have tried, or if they have any medical condition or taken certain medication, or if there is any of that runs in the family. So in that regard, you need to ask what job status do they do, if it's manual, what's the environment condition like, and that kind of thing. So the patient might say that, one case scenario, that she's using a discolored shampoo for hair streaks that in order not to get brass discoloration. And after then, she started to notice this sort of stain. So in that condition, you will think about a condition called chromohidrosis, which is basically bluish discoloration comes along the sweat. It's a kind of rare dermatological condition due to the passing of discolored sweat through the apocrine or eccrine sweat glands that's responsible for the thermoregulation of the body, and it's widely distributed in the palm and the sole mostly. However, the apocrine gland, as we know, is related to the puberty, so it will, in that regard, will happen after puberty, and it's mostly dominated in the axilla and genital region and in the areola. So the explanation for this condition that there's multiple factors. However, one of them is due to lipofuscin granule, which we know it's a yellowish pigment that's excreted whenever there is an oxidation for unsaturated fatty acid. And the story here, the more oxidation, the more discoloration, and the more darkness. So the patient will panic. And usually ladies, they don't like any sort of discoloration whatsoever, and they're gonna do anything that's just to get rid of this color. So as we know, the sweat will be colored due to excretion of water-soluble oxygenous agent. And by that I mean dyes, like in this condition, medication, like some medication, and heavy metals. So the potential agent that we need to think of, like for instance, rifampicin, we know it's orange discoloration, quinine, as well silver, mercury, copper, ammonium, beta-carotene, which is also orange, and of course tetrazine-coated buscodile, which is found in some of the bowel for constipation, those kind of pills, so they can be colored or coated, which would lead to this discoloration. And of course, certain dyes that can be used in the radiological or invasive, undiagnostic invasive condition like methylene blue, fluorescent, and in certain cranberry juices when the colorant and additive has been added. So the excreta of the body will be discolored. In certain rare kidney condition, like uremic frost and hyperbilirubinemia, which can happen, and renal failure can cause discoloration as well. However, in that concept, the apocrine chromohidrosis is more commoner due to puberty and the lipofuscin granule excretion, which is unknownly. And of course, as I mentioned earlier on, the more oxidation, the more discoloration. And the color can range between brown, black, blue, green, yellow, pink, so all sorts of color. So you just need to probe and ask thoroughly in order to find out what was the reason for this condition or not to miss any medical condition. And of course, the diagnosis is mainly clinical. However, you can use the Woods lamp just to see and yell the fluorescent, which can be yellow. And if it's still in doubt, you could do a bunch of skin biopsy or skin scraping and culture. And in certain situations, if there is microorganism like chromogenic, this, of course, will cause something called pseudo-chromohidrosis, which is not the condition. And the treatment and the management is basically withdrawing the offender agent in order for the situation to be resolved. And of course, not to forget some of the differential diagnoses, like hematohidrosis, which is basically a rare bleeding in the intact skin. It could happen with anything, but mostly with fear and stress. Also, alkaptonuria, which can be another differential. It's uncommon autosomal recessive disorder and can cause brown discoloration in the axilla inguinal region, and can be also discolored as brown to blue in the sclera and in the cartilage of the ear. So that's another differential that you need to think of. And another one is the cutaneous hyperpigmentation due to the deposition of the pigment in the skin. However, it's not increased with the sweating in order to differentiate it from the real chromohidrosis. So by that, I hope that I covered just a small thing that any doctor should be aware of and should know about, because it can be very frustrating when you misunderstand the patient or you do not acknowledge what they have been said. Like, for instance, for my situation, when I was hit by this e-bike who collided in my back when I was walking in the pavement, that caused me multiple issues, including my nose. I have issue with my nose, especially when I sleep. My nose clogs, and I can't see it myself because the fracture was on the right side and caused something in the left side. I'm going to write a paper about it in order for others to know about the situation, because when I was asking, no one answered my questions or acknowledged it or even told me what I need to do. So just they left me with this now I need to live with. And even my finger, they didn't correct it. And lastly, because I have also neck problem, so when I write for the consultation, just to ask my GP, I notice they don't even read or hear, which is really frustrating because I'm a medical doctor myself. And you just find them that they write that you've been hit by a car. God forbid, I wasn't even in the road. So this is something really frustrating. So you can understand from the patient perspective how it could feel, how it could relate. And I was just assuming if this GP, who obviously wrote the wrong thing, how would they feel if it was the situation for themselves, if they were the one who had been hit harshly in that way and been through. And someone did not even hear them or read their notes and wrote something completely different and bizarre and just, very harsh. Just tell me how it will make you feel. Thank you.